Now we're going to have to come under the clavicle. We were on top, now we got to come under here, right? I developed this technique at a Costa Rica workshop. For years, I always would dig under the clavicle and try to get subclavius, and it's just a painful, and really you can't get much in there. But if you just take this arm, my left hand grasps her forearm or wrist, however, and pulls it up like this. Look how it pulls the clavicle off the rib cage. Now I can get under. Can you see my fingers here under clavicle? Notice how my fingers are going that way. So I'm coming under like this with soft finger pads, and now I'm scrubbing subclavius. Pulling it up, scrubbing. It's counter force. As I'm pulling up, I'm scrubbing under, pushing them away from their firm attachment of the sternoclavicular joint. All the way over. A little tender there?
No, it's good.
Feels good.
Yeah.
I must be doing something wrong, as Ida Rolf used to say. This is an old osteopathic technique I learned from Philip Greenman, except this is used as a scaling routine more than a first rib routine. I'm going to come under Dina like this with my left hand, and notice this, see her body is like this. I'm coming under between her body and her arm. So I'm going to lift her up here to help her get under her like that. I've got my soft finger pads right here. Can you see my fingers wiggling here? They're against the first rib. Very gentle and soft. Now I want to make sure that my whole body, I'm doing this whole thing with my body. Okay, so I'm going to take Dina's head and slide it over into right side bending, left rotation. Non-neutral mechanics in cervical spine, but neutral mechanics possibly in the thoracic spine. And now I'm going to have her push side bend left against me. So she's pushing left, her head left, 2, 3, 4, 5. I got a counter pressure, and now I'm pulling gently with one hand and pushing with the other to pull that rib down. She doesn't have a rib problem. It's springing really nicely. And when they do, if you get in here to do this technique in the spring, get out, move on. Don't work on anything that doesn't need to be worked on. One more time, 2, as I work on her again, 3, 4, 5, relax.